Second part of the question was about atrial enlargement. Now, the P wave is due to atrial depolarization. So, if there is any enlargement of either right or left atrium, will be shown in the P wave, because P wave is because of the atrial depolarization. Now, what is normal for P wave? P wave amplitude, that is wave voltage, should be up to 2.5 millimeter with a duration that is about the width of the P wave, should be 0.11 second. The best seen P wave activity best seen in lead 2 and V1 of the chest lead, while left atrial enlargement or dilatation is called P mitral, enlargement of the left atrium, which shows in ECG abnormality. That abnormality is known as P mitral, mostly seen in mitral stenosis. Lead 2 changes. In lead 2, changes are shown as the P wave has got is bifid or is broad with notch in the middle. So first part of the half of the P wave is because of the right atrium depolarization, and second half of the P wave is because of the left atrial depolarization. So it is known as P mitral when the left atrium is enlarged, and here the P wave has got bifid or two peaks, one after another, and like a notch in between, and it is best seen in lead 2 and V1. In V1 you will find it as a biphasic wave as shown in the right side of the diagram. The two components, you will see two peaks, one peak and the another peak, and there is a notch in between. This is known as P mitral. Now, in V1, there is biphasic P wave. You can see in the V1 chest lead. Then we come to the description of ECG changes in right atrial enlargement. This is known as P pulmonale. What is P pulmonale? You will see in cases of right atrial enlargement. And in this you will find, as you see in the diagram, a tall pointed peaked P wave in lead 2, and the amplitude of the P wave will be more than 3 millimeters. So, but there is no change in the duration of the P wave. Duration of the P wave remains normal. So only the height, the voltage of the P wave is high, and this is known as P pulmonale. which is seen in cases of chronic lung diseases and in some congenital heart disease. So this is the difference between the left and right atrial enlargement.